Awesome. All right. Well, excited to be here with you all talking about a very important topic. And for me, it really wasn't clear to me that this was such an important topic until I watched my wife try and navigate the healthcare system. So for many years, she was complaining to her primary care doctor, her OBGYN, and most importantly, myself, and going through things like various symptoms, pains, mood swings, all of these things. And she was thrown out with a litany of tests, endoscopies, various images, prescriptions to treat symptoms, but after all of that, she was still left experiencing all of the same symptoms with no clear answer. And it didn't occur to me then, but obviously when I got access to the data that was just described in that video, you can meaningfully change someone's life if you get them to the right doctor. And that's exactly what we did. We got her to a doctor, and on the first office visit, they figured out that she had a softball-sized teratoma growing on one of her ovaries. She had endometriosis that had spread in a couple parts of her body, and she was set on the appropriate clinical care pathway to resolve a lot of that. And what happened was she had a surgery, and now, many months later, is symptom-free and living a normal lifestyle. Unfortunately, though, what happened to my wife happens to all too many people out there. They're left trying to navigate a complex system. They're left with unanswered questions, no symptom relief, and so everyone is frustrated. But if we can get people to the right doctor like we were able to get to my wife, you can really make a meaningful impact. And so the question really becomes, how do you do that? And I think you have to think about it in three ways. One, you have to understand the actual importance of the individual doctor on improving outcomes. Two, we have to understand why employees and members today don't make optimal care decisions. And then three, we have to talk about a fundamental change in our industry to actually align the right incentives to change behavior. And so starting with finding a doctor, right? It's very important, if you think about my wife's example, to do that. But the reality is today when people need to go find a doctor, what do? They Google, they phone a friend, they maybe go on Yelp, they find a doctor with 4 stars and conveniently located 10 minutes from their house, and off they go. Maybe that doctor has great bedside manner, maybe one's a little bit more thorough, but they really have no clear understanding in the cost and quality that they can expect to be delivered. And so what's interesting, when you actually study doctor performance, most people think the difference between a top doctor and an average doctor is somewhere on the margins. But if you look at things like complication rates, revision rates, hospitalization rates, following clinically appropriate care guidelines, it's actually a pretty stark difference between those two. And so if you look at a top quartile orthopedic surgeon, for example, the complication rate of a top doctor is 5 times less than that of an average doctor. Pretty significant difference. If you look at things like cardiology and the clinical prescribing patterns of doctors, they're 7 times more likely to follow clinically appropriate guidelines in the top doctor category compared to an average doctor. And those are just 2 quick examples. But what it shows you here is there's a stark difference in that, and that's just on the quality side of the coin. They also have the power of the pen to determine cost, right? Efficient doctors are going to utilize the right sites of service, so having the same procedure done in an outpatient ambulatory center compared to an inpatient setting has anywhere from 3 to 7x the total cost. And things like unnecessary and wasteful care. There's a lot of studies out there that in the US health system, about 1/3 of all care can be bucketed into fraud, waste, and abuse. And it's very clear in the data which doctors are contributing to that and which doctors are helping actually solve problems and avoid unnecessary care. And so that's kind of the importance of the doctor. I don't think that's too controversial. But then the question becomes, why doesn't everyone seek out a high-quality doctor? Well, first, we have to understand what tools are available to people, right? Not many. So many people, again, are going to Google, now ChatGPT and all of the AI front doors that are available, but there's no real access to cost and quality information. And so they kind of just go back to phoning the friend and whatever's convenient, that's where I'm going to go. But what they actually need to do is get access to the right information. And so if you think about the quality perspective, the things out there, you can go to the US News and World Reports, there's health grades, there's also ZocDoc and companies like that. But what they actually are kind of just how nice is the doctor or is the receptionist great? You can't really get meaningful information into what is the complication rate of my specific provider. And the other thing out there are provider carrier directories which are plagued with inefficiencies. Is the doctor actually in the network, accepting new patients? Do they have a reasonable wait time? Is the phone number right, the address right? People call down, they get frustrated, they can't actually get in to see them. And then there's cost tools, right? Trying to guesstimate how much it's going to be. The tool says, hey, it's going to be $100. You get a bill in the mail 6 weeks later saying it was $350. A lot of frustration. People don't trust them. So again, they just go back to what they feel comfortable with. And so the question really becomes, the doctor's super important. People want information but can't get it. So how do you actually solve it? And so what I think is important is that we understand that traditional health benefits are no longer working. There's broad access to broad networks. That's important because people want choice. But there's no real meaningful incentive or differential as to seeking out the top doctors compared to just the average, and we already established that that is a key decision. And then there's been other things out there that have tried to kind of tackle the problem. COEs are great in merit, but are viewed sometimes disruptive, and you have to force members to travel a long distance to get in there. They also focus on a narrow subset of conditions. And then there's also things, alternative health plans are really big right now, variable copay models as well. You want to make sure that there's important data behind it, backing the recommendation, and it's truly based on quality and cost information. And the other thing you have to make sure of is that there's huge variation in the decisions that members make. A $25 copay differential generally is not going to make people make a behavior change. And what I've actually seen in some of the data is the difference between a $25 copay and a $50 copay. Some people actually choose the $50 copay assuming I'm paying 25 bucks more, I'm going to get a better outcome, a better doctor, and that's obviously not the intent. So as you saw in the video, we think it really starts with fundamentally understanding the doctors that you're going to go see. And if you can get access to cost and quality information that truly shows you how they're going to perform, that is a way to actually make a difference. And then you have to incentivize people. You need something meaningful that's going to hit their wallet. And it's very interesting to me, right? Companies manage expenses drastically different for everything else compared to benefits. I travel a lot for work, and we have a per diem allowance as it relates to food. They're not limiting which restaurants I can actually go to, but they are going to limit how much I'm going to get reimbursed. And that's how we think about this from the health plan design is you have to give people choice, but you have to reward the right behavior. And so we've aligned financial incentives with members, and they see about an 80% out-of-pocket reduction when they actually choose the right choice. And we think that is really the key to solving the problem. You have to align the right incentives for employers. They want to spend less on healthcare and have their people be better off. And employees, they want the right quality information and also want to pay less. And if you point both of those alignments right on the high-quality doctors, that's really what we believe is the truth to solving the problem. So I know you all are in here for a reason. You're innovative and want to make a change. We're really excited to be a part of it, and hopefully we can work with you guys soon. Thank you.